careers during COVID, helping our audience understand how this pandemic is impacting workplaces and careers in development. Today, I am very excited to be joined by Dr. Christine So, who is the CEO of Humentum, and they are a membership organization that provides training and guidance to development organizations. Dr. So is also an epidemiologist with a 25-year career in international development and global health. So in addition to learning what she is seeing and hearing from her vantage point at Humentum, I also look forward to discussing how she thinks COVID-19 will shift global health programming, now and in the future. So Christine, thank you so much for joining me today.
Yeah, really happy to be here. Thanks for inviting me.
So you are a membership organization supporting a wide range of global development organizations and professionals. How has the support your membership seeks shifted in the past few months in response to this crisis?
Well, I think that we saw immediately that, the sector, as we were seeing globally, just nobody knew what was coming next. We had all these unknowns and uncertainties in front of us. And so much of what we do in particular across the sector relies on travel. It relies on face-to-face contact. It's community building. It's direct service provision, especially for healthcare. And so, that was all just thrown up into the air. And so for Humentum, we have always provided online training and online convening, but we pivoted hard and fast to being able to provide a lot more of that. And we also had to walk ourselves back from the face-to-face work that we had been planning to be delivering over the course of the year, because that also was part of what we do, both in terms of face-to-face training, face-to-face consultancy, and then our big conference that was coming up in September, and also a conference in Nairobi that was scheduled for the first week of April. So we have taken everything online. We are really endorsing and embracing being digital first. And we've really been trying to listen to our members and to the community and to the stakeholders to help inform us on what people need and what we should be providing. So really taking a member-driven approach, and I think that's paid off. And I hope that certainly from what we've been hearing, what we've been able to provide in terms of support, just around learning and convening and training and all of the things that we usually do have resonated and been helpful to the sector.
Great. Well, I definitely can empathize with the needing to move everything online.
Pivot hard, yeah.
Yeah. So one of the key areas Humentum supports is in human resources, and recognizing people are the core of development work. It's something that I personally believe and are passionate about. I imagine you must be speaking with HR leaders and just leaders in general about how to support their people at this time. So what kind of questions are you hearing or discussions are you having as organizations really think about how this is impacting their people?
Yeah. Well, Humentum, as you say, Humentum has worked with HR leaders for many years. And our platform that was already developed and very active is our Connect platform, which is an online communities of practice for members. And that is really, it's a written area where people can exchange best practices and post questions and that sort of thing. But we really right away started convening the HR community in two ways. We do on Mondays an executive level convening, which is mostly executive level HR and operating officers who come together and talk about what needs to be done, what people are struggling with, asking questions, trying to come together as a community, to come up with solutions. I think that's been extremely helpful. We also have an online convening on Thursdays, which is open to all members, but tends to have a large group of human resources professionals attending those meetings and doing the same sort of cross-sector discussion and really looking for solutions and sharing challenges. And I think that that's resonated both in terms of being able to help people think through how to address their most pressing challenges, but also just giving everybody a space to come together and say, oh, I'm so tired. I wake up every morning at 3 a.m. thinking about this. And somebody else says, yeah, I'm thinking about that too. And just the importance of having an active peer group has really been very evident throughout this crisis. Along with that, we've really been trying to work with human resources officers and leadership, thinking through what are the challenges that our sector partners are negotiating. So, for example, how can we be covering salaries? At the beginning of the pandemic, we were looking at, will USAID, pay for people who aren't actually able to do the work that they are supposed to be doing under their grants and contracts? Looking at differences between, what's going on in the US and then how DFID is approaching the same sort of employee coverage issues in the UK, and it's been very different. Helping organizations navigate, especially in the US, navigate the payroll protection program, applying for that, figuring out again, how they can use that to cover staff salaries, what the overlap is with what USAID is looking at, and we're still working on that one. And then thinking about, like, are we freezing recruitment? What do we do with staff that normally are expatriate but have been repatriated to their country of record? What are the tax implications to that? This has been incredibly complex, and so I'm pleased with the way that Humentum has been able to provide a platform and facilitation for these discussions, and I think we've been able to help keep track of and red flag the most important issues that have been coming up for the last several months, and really help. Not so much, I don't think it's for us to tell people what to do, but we can bring people together to identify those solutions and then help make sure that those solutions are available.
Yeah, and you bring up an important point, is the role of donors and how they're supporting organizations. And we actually have been doing this Devex Trends Tracker survey each week, surveying our community. And 2/3 of respondents said they didn't think that donors were doing enough to respond to the pandemic. So how are you seeing them respond? You mentioned like very granular issues, even around like tax implications, which I'm sure is incredibly complex, but even issues like maybe diverting funding to purchase PPE or reorienting program funding to respond to COVID. How are you seeing the donors respond, and what more would you or your membership like to see them do?
So, again, I think donors have responded differently. It depends on their political context. It depends on their funding context. It depends on how they work. I think that, USAID actually has been, really responding ahead of the curve compared to some of the other donors, and that's great. They have struggled with some of the issues, and PPE is a perfect example. We saw informal guidance come out at the end of last week, and I think there's more formal guidance that just got posted today. But that's been a major problem for the organizations that we work with, and for the development sector across the board. We understand the concerns around that, but that doesn't mean that we shouldn't be taking steps. We have a duty of care to our employees across the board to provide them with the protection that they need to be able to do their jobs safely. So, I think government donors have the challenge of figuring out what their position is, what is feasible, what they can support, and then also negotiating their political environments. And so that can be very challenging. But at the same time, they need to be responsive to those who they are expecting to actually carry out the work. And I think that, again, we've been really happy at Humentum that we've been able to play a very active advocacy role, helping negotiate that discussion between implementing partners and USAID and DFID in particular, really flagging those issues that are of top concern to the community, and working with the donors to push them towards solutions and responses that are appropriate and actually meet our needs and respond to the issues that have been raised. I think we also see important advocacy going on, and I think Interaction has been leading a lot of that around, the importance of continuing the funding to development assistance, and that, just because we are dealing with crises domestically does not mean that we can stop doing our work internationally. In fact, it's more important, as we've seen in other global pandemics. So I think, we just have to really underscore the importance of advocacy. And I'm pleased that Humentum has been able to grow their advocacy, our advocacy role, especially I think over the last year, but in particular over the last 3 or 4 months.
Yeah, and I think you bring up an important point about being able to continue your work. And again, in this survey we've been releasing to our audience, we have 55% said they're concerned their organization would not financially survive the pandemic. Many were concerned about losing their jobs. Some already had reported losing their jobs or income. We have heard of layoffs already. I think probably most notable being Oxfam. But what are you hearing as to layoffs or job losses and concerns around organizations to even be able to financially survive the pandemic?
So, we have certainly been hearing those concerns. I think we've been seeing in the US that there is possibly more optimism from organizations in the US compared to organizations in the UK. DFID is actually in the process of cutting funding right now. And we are trying to work with them to make sure that the way that they are going about that actually takes into account how organizations are working and what is, top priority, rather than just taking a blunt instrument to it. But in the US, I think we've seen some more optimism because, USAID really has been a bit more forward in terms of talking about and having policy and guidance around, what can be covered during the pandemic and how we should be working. I think that, what we are seeing is that inevitably in any sort of crisis, there are organizations that were already in trouble, and that this will speed up that trouble for those organizations. And so, as we are also seeing in the restaurant industry and in other industries, those organizations or companies that were already having problems may be tipped over the edge by this. At the same time, I think a positive that comes out of this is organizations that may have already been, putting their toe in the water, thinking about new strategy, thinking about how they can be more agile or adaptive, maybe pushed into taking that on faster than they would have otherwise. And, I think that there's some interesting research that came out of the 2008 financial crisis that has shown that there are some organizations that took on, pretty risky but educated bets about how they were going to pivot and develop, and they really came out stronger because they were able to be agile and adaptive. And so again, coming back to how Humentum is working within that, we are hoping that we can provide the resources to organizations that are trying to adapt how they work. And I think, online and working from home is a perfect example of this. Everybody has been forced to work from home, and that has been a huge shift for many of our organizations. And now, trying to help them think through, well, strategically and financially, does it make sense to keep your employee workforce virtual, or does it make sense? Is it necessary for them to go back to the office? But, we are really trying to work with organizations to think that through in a structured, strategic way, rather than just kind of doing knee-jerk reaction. Oh, offices are open, let's send everybody back to the office. It isn't that simple, and we need to think through how we how organizations are doing that, and we want to support that. I will also say that, Humentum, also, we were about to go into our own strategic planning process just prior to the beginning of the pandemic, and we shifted all of that, and we've done some webinars and some sharing and blogging with our community about our own process. But, we moved all of that online. We shortened our timeline. We went through a really rigorous prioritization of what we can and cannot do, and how we can, work, again, to be as responsive as possible to the community while making sure that we stay financially viable, and how do we protect jobs and job security within the Humentum family as a result of, the uncertainty that we're facing. So, we've been going through a lot of the same thing, as well as helping to support our organizations.
Yeah, definitely. And you think about, if we are no longer bound to specific office locations, I think we really could see some real progress on, we've been talking for years about like localization or local ownership. But I think it's interesting to see organizations really thinking about how they can put that into better practice now, when your physical location isn't as critical, being in a home office in Washington, D.C., where I'm based, or in London. So it's interesting to hear those conversations are happening, and it'll be interesting to follow to see what kind of organizations reorient how they structure their workforces, including where they are, to be more responsive.
Absolutely. And I think that that's the perfect juncture that we see between, what we were already managing through the pandemic, and then, the social justice movement and the protests that have been going on over the last 3 weeks. And, I think, again, some of us were already moving towards thinking through, okay, well, how does, having a virtual workforce work to help us be more equitable and be more diverse and inclusive. But, we all have, the onus is on us. We all have a moral and ethical mandate to really be looking hard at the way that we work, the way that we recruit, what our processes are, and to really try and puncture our assumptions. And I think that, and we were just talking about this at Humentum this morning in our leadership conversation, around recruitment and around the idea that, we are virtual. We've been a virtual workforce for the last 3 years. And are we doing enough when we recruit to go beyond the boundaries of the US and the UK and really have global recruitment? And there are practical implications to that. I mean, you have to think about tax implications and employee contracts and those practical considerations. But, there really is not a huge reason why we can't be, expanding our reach as a global employer. And I think that our member organizations and members of the global development community really need to be just asking themselves those basic questions. Are we recruiting in a way that is encouraging diversity and equity and inclusion? Can we do it differently? If we're going to do it differently, what are the things that we need to think about, those practical considerations? And I think it's good to be breaking down our usual ways of working and thinking about doing things differently. But I think it's also important for organizations to be really thinking about, what are their principles? What are your organizational values? I think that most organizations have those. Many organizations have organizational values. But also, just in terms of principles, if we are going to talk about diversity, equity, and inclusion, what are the principles that serve as our North Star? What do we continue to look back on and say, okay, are we meeting these principles? Are we meeting these values? And then constructing or deconstructing our systems and processes to actually get us there. So not just doing things piecemeal, but trying to do them with some sort of guiding value statement or principle statement. And again, Humentum is working on that now. So
that's great. It's great to hear those conversations are happening, and say this is the convergence of multiple things at once, which could lead to a unique opportunity to really enact quicker and faster change. So hopefully we'll see some of that to come. So you also provide training to professionals, individuals, people having more time at home. Definitely have been hearing about many people taking advantage of that time to do more online learning and upskilling. So have you seen any shifts in people and demands for this training? And if so, are there any particular skills that people are looking to grow in, and maybe in particular in response to the pandemic?
Well, I think the obvious one has been around how to manage a virtual workforce, both efficiently and effectively, and and sensitively. We hear about Zoom fatigue, and so a great example of that is we held a webinar now a couple of weeks ago where that was on icebreakers and energizers. And when we were planning it, we thought, well, we'll have, 15, 20 people, and we can break them into groups. And we had over 120 participants. And so we had to rethink how we were going to offer that. But, that's just an indication of how, human resources and leadership and just people who are on these meetings all the time are realizing that they need to do things differently. And so that's something that, we are integrating into our training approach and making available. I think, overall, we have been really looking at, how do we get all of our training online? There were some things that had traditionally always been face-to-face. Humentum has always provided the USAID rules and regs course, which has been a face-to-face course. We're now offering that online, and we're now in the process, actually, my team will kill me because I'm not quite sure if we've done this yet or not. I think we have translated it into Spanish, and we are translating it into French. And so, again, thinking about how do we make this more accessible to more people. And so part of that is, already with having it online, we can offer it to people who might not have been able to travel or didn't have a budget to travel. We do have to think about accessibility in terms of bandwidth and access to internet. So that's an issue. We are trying to make it more accessible by having it in different languages. One thing that we've been talking about is, can we close caption it? And what does it mean to be close captioning online training, especially when it's being done live? That is a challenge. So, we are transitioning to how do you do training online and convening online. We held OpEx Africa conference, the OpEx Africa conference, the first week of June, and that was a completely online conference. Again, that was a pivot from what we were going to be doing in April to what we actually did in June. We had almost, we had 350 participants over 4 days. So it was much bigger than we had actually thought it would be. We had great discussion, and we really, from the feedback we got and from the experience that we had, we saw that it was by doing it virtually, it was kind of an equalizer. When you're at an in-person conference, you have the talking heads up on stage and the audience, down below. And if you want to ask a question, you have to go up and stand in line at the microphone, and maybe the talking heads will answer your question, maybe they won't. By doing it online, we found that we could have really at the moment integrated discussion, and people would be putting their questions and comments into the chat, and that would be taken and immediately fed into the facilitation of the discussion. And so we got responses from people who said, I've never thought that I could actually get my question answered in real time. So that kind of an experience is it's learning for us as well, but it's stuff that we're going to be applying as we go forward. So, I think in terms of online learning and convening, it's an exciting time, and we need to just be constantly learning and adapting the way that we do things to make it relevant and meeting people's needs.
Yeah, definitely. I think myself seeing the increased access is one of the more exciting parts about everyone going online. And we had to change what was supposed to be an in-person career fair in DC in March to being online. And one of the beauties of that is we were able to have candidates from anywhere in the world participate. And as you say, even think about language accessibility, but even maybe different personality types, because not everyone feels comfortable going up and asking a question in a room of hundreds of people. So when you think about diversity in all different aspects, this really does provide some opportunities. Another thing that I know you all have worked on, and I'm going to ask because I get asked all of the time from people in our audience about project management certifications. it's one of like the top questions. And should I get one? Which one? Do employers value it? And I know that you all have developed the PMD Pro, which is specifically for development, project management, and specifically designed to be accessible to really any professional globally. So since I have you, can you talk a little bit more about that certification and who it's meant for and how that process works?
Yeah, I'd be happy to talk to you about it. And I will say I'm going to take I'm new to my job, and so I have a bit of a caveat because I don't know about it as much as I wish I did at this point. But yeah, PMD Pro and the program management training that we do is a very important part of our offerings. And I think what I can say about it immediately is that we've been really thinking about how do we offer it. It's fully offered online, but also thinking about consultancies and offering it at the organizational level. So not just having to again, which was typically done in person, we could come into an organization and work with all of their staff in person, and now actually really thinking with organizations about how can we provide this kind of support and training at the organizational level, but not necessarily doing it in person. And again, I think that's a way that we can make things more accessible. You asked about, who can do it. Anybody can do it, but really thinking about, rather than people who may be in a position kind of lower down within the hierarchy of an organization, who might have more difficulty getting a travel budget, for example, to travel to an in-person training. Now that's the kind of thing that they may be able to access through their organization in a different way, because it is going to cost the organization less. And it's something that they can either, they can do through their organization's auspices, or they can do by themselves. I mean, that's their own investment, but it is available to them as well. And so I think that, whether it's PMD Pro or whether it's, the financial management courses or USAID rules and regs, there are various courses that are available. And we've got the whole HLS catalog that's available that, again, people can do through their organizations or through their own means. And one thing also I want to mention is that, at Humentum, we do offer some of our learning and some of our webinars for free. And one of the things, again, that we are really looking at as part of our DE&I approach is making sure that we are offering courses and learning and convenings and things that are available to people who may not be able to are parts of people who work for organizations who may not be members for whatever reason. And so they may have challenges being able to pay for the courses that have tuition, but making sure that we're offering courses and other things to people that they can access for free, so that at least they can get the first level of resources and support, and then maybe figure out a way to get better access through their organization for the things that require payment. But acknowledging that it is important for people to be able to get to things regardless of what their financial purse is.
Right. Yeah, exactly. So pivot a little bit. I mentioned at the start that you are a trained epidemiologist with extensive experience in global health before joining Humentum, which I think was maybe just the end of last year, not too long ago.
I joined at late November. Yeah.
Okay, great. So you led Palladium's global health portfolio and Global Health Council. So we know that COVID-19 is already impacting low resource countries and are bracing for much more to come. So what do you think organizations and professionals need to do to prepare for this?
Well, I think that in the global health community, we would say that we were already really trying to prepare for this. There's been, incredible global health security work going on for the last 6 or 7 years. Some of it predated the big Ebola epidemic, but a lot of it came out of that. That global health security work is still ongoing globally, although the U.S. has not continued, has deliberately discontinued its engagement, which is tragic. on so many levels, and a travesty. And so, the global health community has been working on global health security. They've also been working on health system strengthening. And, we need strong health systems. We need strong global supply chains and local supply chains. We need not only national and formal health systems, but we also need community health systems. Health goes so far beyond just, the hospital. It goes down to the clinic, it goes to the community health worker, it goes to, traditional healers and leadership at the village level and at the community level. So we need strong health systems. I think one of the things that we have seen that's been really accented because of the nature of the coronavirus and the response is this tension and friction between public health and what we need to do to keep people safe and to keep the virus from getting out of control versus economic health, and what happens when these two are in direct opposition to each other. We're saying for health reasons everyone has to stay home, and on the economic side we say yes, but that's going to kill the economy. And we know that also has very real implications at the local and individual and family levels, where, especially in low resource settings, people who work in the informal economy can't stay home. They will starve if they stay home. And staying home may mean being in a home that you share with 14 other people. And so, we can't have blanket responses. We need to have adapted responses. I think we're getting better at that, but I think also that, at the beginning of the pandemic, when we were really seeing it take on momentum, we were working with blunt instruments because we didn't know where this was going. And in great part, we still don't know where this is going. And I think that's one of the big frustrations is people want to have answers, people want to have clarity, and we just are not going to have that. The other big frustration for anybody who works in public health is, we work in prevention. Well, if you prevent something, then it doesn't come to pass. And people say, oh, that wasn't so bad. It didn't happen. See? And we say, yes, but without us, it would have killed millions more. And so again, there are definitely some tensions around that. The other thing I think that we need to really mention is that specifically for global health and domestic health, I mean, we're seeing this in the US, we're seeing this in every country, is that by pivoting the health focus to the coronavirus and to the COVID-19 control, we have also seen a real impact on other health services. So we know that, for example, there is an impact on global vaccination rates, and that we are going to see many more kids get sick and possibly die because they've missed out on critical vaccinations. We are seeing, breakdowns in malaria prevention and control in countries across the global south. I mean, right now we're going into rainy season across much of Africa, and if we can't we've made incredible strides around malaria control and prevention, and if we can't keep that up, we're going to see people dying for other reasons. In the US, we've seen just use of emergency rooms and of cardiac services plummet because people have been afraid to access health services because of coronavirus. And I think across the world, we've really seen an uptick in the need for mental health services and support. And that was already an area that was highly stigmatized. And, maybe possibly the glimmer of hope in that is that as people get more comfortable with accessing services online, that we are seeing more mental health services being offered, and people are going to start accessing them more. I think we've also seen the insurance companies expand some of their coverage to telemedicine and mental health medicine, and so really increasing accessibility, but we still have a really long way to go.
Yeah, for sure. I personally am loving the medicine and hoping that continues. Certainly, that makes it easier and for anyone. I've heard people talk about this pandemic being the great equalizer, but that everyone is susceptible, but we know that there are certain communities that are more susceptible and will have a disparate impact on. So important to keep that front of mind, and probably also underscores, this, that we can't have just such, specific programming. This focus may be very disease specific, and looking more at these health systems and investing in community health workers so that we can weather whatever the next COVID is. Hopefully we don't have something like this again anytime soon. But are those conversations that you're hearing and seeing global health organizations talking about, is the way we do our programming being very vertical, and the need to really be thinking beyond that?
Yeah, absolutely. And I think it's thinking beyond vertical approaches. And I think the most exciting stuff that I'm seeing is really that we're getting traction and we're getting visibility around, making sure that the voices that we do not hear have a place at the table. The virus. Well, the virus does not attack equally because there are underlying factors that actually make different people in communities more susceptible. It also has just exposed such incredible inequities and inequalities, across health and across economics and across, race and gender and everything else. But I'm excited because I'm seeing, great organizations like Women in Global Health, and who I've worked with a lot. And so I'm happy to give them a little plug here, but, really having very dynamic discussions around, it's not just about gender. I mean, they're working on the intersectionality between gender and race and income and, sexual sexuality identification. All of that, is being talked about. And I think the big challenge that we all have in front of us and that we have to kind of grasp onto and not let go of is not just having yet another conversation that kind of falls back and gets forgotten as we move on to the next thing. I think that is hopefully what is different about this moment. And the fact, as we look at the social justice protests in the US, that those have gone global, that is amazing. And it really, highlights that there are social injustices and, deep crimes against humanity being committed across the world. But that we are getting traction on it, and we are talking, and we're using social media, I think, in ways that it can be harnessed for good and for transformation, and all of that's really exciting. And I do see our organizations talking about it. I think that there are some within the global development sector who are very, very ready to dismantle the traditional power structures, and there are some who are going to dig their heels in and say, nope, we've always done it this way, and we're going to continue to do it this way. And some of that is because of our organizations ourselves, and some of that is because of where we get our funding. But I think that it's up to all of us to take a really critical view of how we are working, and to open ourselves up to having uncomfortable conversations. If it's a comfortable conversation, you're probably not having it right. We should be asking difficult questions, and I love it because now if you do a simple Google search, you can come up with those difficult questions that you can use as conversation starters. Do it within your own leadership team, do it within your community. Use those as the basis for review of your policies and your approaches. But we need to be shining a light on all of this.
Yeah, I think bring up some really important points. And I don't think as a sector we've always practiced what we've preached when it comes to social equity and inclusion and equal access. When you look at the staff and leadership of many development organizations, not very diverse or reflective of kind of communities that we serve. So are those part of the conversations? I know you're bringing different leaders together. Are those some of the conversations that you're seeing them talk through, and about practical ways that we can improve as a sector in this area?
Yeah, they are those conversations. And, for instance, I convene a group of Humentum CEOs in a once a month roundtable. And, so last week we came together and we had a really good conversation about, how we're working on this and what are some of the challenges that we're facing. And, Humentum, we are not subject matter experts on a lot of this, but we can bring those subject matter experts to these convenings, to these roundtables, to the learning that needs to be done. And so we're trying to do that. And, we are trying to remind people that they do need to be having the conversations and that there are real best practices out there that can be followed. And so I think, again, it's uncomfortable, but it's exciting. Actually, one other thing I want to really underscore, which again, within Humentum, I have committed to as Humentum CEO to our staff, and I think we all need to be doing this, is holding ourselves accountable. So having clear statements about what we aspire to, what we are going to get done, having some metrics against those goals, and a timeline, and then build in accountability around that. And don't be afraid if somebody points out that, hey, you've missed a timeline, you missed one of your deadlines, or you missed a mark on this. Thinking about how you can set it up so that you can get that kind of feedback and you can report out and be held accountable, because that's what makes things move forward. If you make vague statements or even very specific statements and then never come back to them, it doesn't change anything.
For sure, it can't just be lip service.
No.
So what do you hope will be some of the biggest changes to the way we do development work as a result of this pandemic?
Gosh, I think first and foremost, and this gets to the idea around careers during COVID, is really that we have seen the withdrawal of a lot, not all, but a lot of expatriate staff from all of these programs that are run by big international NGOs. And that means that somebody else local is probably doing that job, and they are being able, hopefully, to move into roles and responsibilities that may not have been accessible to them previously. And so I think that I'm hoping that may force the issue of, how do we operationalize localization in a way that was difficult to imagine even 6 months ago. So, really seeing openings for local and national staff to step in and take on leadership that they may not have had access to previously. I would challenge organizations to think deliberately about how and if you move expat staff back to their roles, because I think organizations tend frequently to just kind of do the knee-jerk reaction, like, oh, we pulled somebody out, now we're putting them back in. But actually think about it and think, do we need to send that person back? Or can we rethink how we are hiring and filling for these positions? Along with that, donors then need to be more flexible about who they require in those positions. And so maybe we call on donors to accept that, oh, well, if you've had somebody in the position for the last 6 months because they were filling in, maybe you let them stay there. And so that, again, may break apart some of those glass walls and ceilings that we have had in the development sector for a long time. So I'm hoping that really helps shake things up. And along with that, again, in terms of localization, that because we may have, seriously reduced travel over a long period of time, that we are able to, again, force the issue around having local consultants and local expertise, and, thinking through new ways of working to really shift not just the work, but also the power and the decision-making from, the global headquarters or wherever down to the local level. And one of the interesting things that we've heard from some national staff is, that they kind of feel like they've been left on their own. And I think that they feel some abandonment, but also, again, I would say, let's pivot this to, okay, well, if they've been left on their own, what have they been able to accomplish? And how do we support them to take that forward, rather than just trying to move things back to the way things used to be?
Yeah, no, I think those are all really important points. Thinking along the same lines. And so what advice would you have for, we have people probably just finished a graduate degree, or looking for their job and launching a career in global development, particularly those who've come from, Western donor society. What advice would you have for them about the changing role of those of us who are based here in the US or the UK or in Europe, for professionals working in a space, recognizing that most of the work can and should be done by people in those countries? So yeah, I guess just what advice would you have for them on how they should think about how they fit into this sector as we see these changes that are much needed?
Well, I think that's been an issue and a question for our sector for a long time. I know when I was at Global Health Council, we were, convening future of global health career parties and discussions around exactly that issue. It's a hard one because we need to be humble and we need to be respectful about what each of our roles is. And if a job can be done by somebody in a country in the global south, then they should be doing it. It shouldn't be done by somebody coming from a northern country. But it means that I think we have to think again about how do we challenge existing power structures, and that has to be done from here as well as from there. And so, it is thinking about, how do we create new ways of working together? How do we create more dynamic ways? Let's use, virtual and online convening in new ways to create, equal partnership platforms, perhaps, rather than, we are the Northern know-it-all who's going to come in and tell you how to do things. I think, right now is a particularly challenging time for anyone who's just starting out their career. And what I think I have one thing that I've said to people in that position for a long time, and a new thing that's come out of the last couple of months. The existing thing was that, don't think that your career will or should advance in a linear fashion. Look around and don't be afraid to take opportunities that may carry some risk or that may look like a lateral move rather than a vertical move. Sometimes lateral moves provide the most interesting ways of learning and experiencing new things. And maybe even it's not even lateral. Maybe it's taking a little bit of a step back to move into a new area to work on something. But just, don't think that it's just going to go straight like this and that's the way that you're going to have the most satisfying or successful or impactful career. The other thing, and I guess it's very related, but I think it's become more important during the pandemic, is the idea of agility, and really not clinging to I only work in one way, or I only think about things in one way, but really challenging yourself to learn new ways of working, to learn new ways of thinking, to be exposed to things that make you uncomfortable and make you stretch in new ways. I will give a very simple example, but when I came to Humentum, I had never used Slack. I had barely used Zoom. Whatever, now 6-7 months in, I am just so happy that I have learned those skills, and they have changed the way that I work. And so, I think, again, that's a very simple example, but really being agile, and in terms of looking for jobs and looking for career opportunities and defining your own self as, someone with a career. Yes, it is important what you have done and what you have learned, but I would encourage you in, putting together your CV, in the way that you talk about yourself in interviews, in the words and the concepts that you explore in a cover letter. Think about your competencies. Think about, what is it that I know how to do? Like, I bring people together really well. Like, I can facilitate a conversation, a difficult conversation really well. Like, that's not that's not something that you would necessarily find on a terms of reference or a job description. But right now, that's a skill that is in great demand. So, think about those skills and competencies that you have, and how you can package them and market them and promote them and talk about them, because those may be the things that get your foot in the door in a way that just having your kind of classic CV approach isn't going to do these days, both because there are just so many people on the market, and also just because things are changing so fast that people are really looking for like that difference in the person that they're looking at and considering, and also they're looking for those kinds of skills. So think about agility and how you talk about it.
That's great. Yeah, it's great advice. I think that's been an important skill to have in development that has only become more apparent the past few months as everyone's had to really shift the way they do their work. So as things start to open up a little bit, what are you most looking forward to doing when you can get back out there into the world?
Oh gosh. Well, I will say I just moved out of the DC area, and I love DC dearly. And when I first started planning this move, my thought was I would be back in DC every month. And right now that's totally on hold. So, of course, like everybody else, I look forward to being able to seeing people more in person. But at the same time, now that I've gotten used to seeing my friends who are nearby on Zoom all the time, it was easier to leave the area. So, that's okay. Gosh, I think that there are so many interesting things going on that I'm looking forward to really over the next 6 months thinking about, how can I best focus my efforts to help, get Humentum farther along the road in supporting our community, really digging into that question about how we dismantle power structures and what comes after, and what does it mean to taking a step back and maybe making room for others. So I'm looking forward to that. And I'm trying to really take advantage of the nice moments during the day. I get up, I go out, I walk my dogs first thing in the morning. Now I live in a very quiet neighborhood, and we've got dirt roads and a lot of trees and bunnies and deer and things. And I really try to just really deliberately appreciate that when I go out and walk. And now I have my desk set up, so I'm looking out in the trees, and there have been robins hopping around, in the trees in front of me while I talk to you. So just being more deliberate about noticing things and being thankful for them.
Yeah, it kind of gives us a moment to take a breath too, right? Even while we're busy at work. Well, thank you, Christine, so much for taking the time to share your thoughts and insights with us today. Really appreciate it. Hope maybe we can catch up in 6 months and see where we are on some of these issues as a sector, and see the work you're doing. Because I too am very interested in seeing how we can really make some impactful change at this moment. To everyone else, thank you for tuning in. If you are interested in learning more about how this pandemic is impacting workplaces and careers, please check out the other videos in our series. If your organization needs support with recruitment or hiring during this time, please reach out. The Devex Talent Solutions team is ready to help you with all of your talent needs, and we'd be happy to talk about how we can help your organization. But in the meantime, thanks again, everyone. Stay safe and healthy.
Thanks so much.